and now, which will be relatively short considering who's giving it. So thanks very much for inviting my wife Sharon and me to your reunion and to enjoy this evening with you, and greetings from myself and other members of the faculty and from the University of British Columbia on this big event, your 30th anniversary. When Alexander phoned me, he said, you probably remember us as being a really bad class and everything, but would you come anyway? I suspect he had gone all the way down the list and he is now an M. And so I said, I actually don't remember you as a bad class. You were a very good class, and from what I know about you, you've been a very successful class. And in fact, this is not a lie. I was going to say it's not bullshit, but it's not a lie. You were in fact my favorite class. I remember you very, very well. We had a very good interaction. And it was a pleasure teaching all of you. What I liked about you was that it was a very smart class. I remember that. But also, there were a lot of hellraisers in this class. And you really had a lot of fun. For example, Coteau and Jewison led a delegation down to Blaine, Washington to attend a showing of a very dramatic movie, classical movie known as Deep Throat. Either this class was the class that started Harvey Wallbanger Night, or you were very good attenders of Harvey Wallbanger Night. Is Jim Farquhar here tonight?
He's late.
He's late, okay. Well, Jim had a very interesting interaction with Harvey Wallbanger Night. I'm sure he's still metabolizing the alcohol 20 years later.
And the floor.
And
the floor.
And the floor, yes. I was going to ask him if he had ever bothered to, or if he'd ever had the desire to have a Harvey Wallbanger after that particular event. The other reflection I had about this class is that you were now much older than I was when I taught you. And I'm sure that you felt I was fairly ancient at the time, but consider that now and be a little bit more philosophically about it. Another reflection is that there were two graduate students at the time you were there, named Helen Burt and Peter Soja. I don't know if you had them for TAs or whatnot. They are now full professors in the faculty and are very well established, again, showing you that the years do go by. Virtually all of the faculty from your time, you didn't have to worry about them coming and eating up all the food because they aren't there anymore. With the exception of Sid Katz. And Sid is actually not on faculty, he's not teaching anymore. Some of you may say, well, he never taught anything anyway. But anyway, Sid is over in the president's office. He runs the Chan Center, and he's also involved with the fundraising at the university, and he's very, very good at that. And you remember how he used to look and how he used to dress. He cleans up real good. He's got a shirt and tie now, no velour sweaters anymore, no can of Pepsi in his hand. It's a glass of dry white. And he's doing a very good job still for the university. Unfortunately, Drs. Halliday and the Goodies and Dr. Ronikis and Mr. Zacharias, Mr. Moyer, Ms. McKinnon, and Lynn Trottier have passed on. And that's very unfortunate, but, and the rest of the people who were there when you were there, as far as I could tell, have all retired or left us. But I still see Dean Riddell, Finley Morrison, Terry Brown, Jack Diamond, Gail Bellward, and John Sinclair a fair amount. We have sort of an old folks sit and spit club that has lunch every 2 or 3 months, and we talk about all our medical ailments and things, and so I still do get to see them. Now, Dr. Brown's an interesting biological specimen. I looked at your yearbook, and there are lots of comments about his behavior. And I'm sure you remember all those dynamic lectures I gave you on drug abuse and the use of alcohol and how deleterious it was to the body. Terry's now in his late 80s, and he's obviously the very tail end of the bell-shaped curve as far as responses and toxicity to alcohol. I don't know if you remember Ray D'Souza, who ran the storeroom. Anybody remember him? Great guy. Ray left us, went to the University of Toronto, improved his education. He's now a vice president at the University of Toronto. So he's another one of our success stories. I mentioned this class has been a very successful class. Some of you have kept in touch with me, and some of you come to faculty occasionally, so I am reasonably up to date on what's been happening with the class. Most of the successes are fittingly in pharmacy, but there are members of this class who have gone into academia, medicine, dentistry, and business, and also done very, very well. This class produced 3 professors. One was a classmate, Mark Levine, who's now a full professor at UBC. Peter Jewison was a full professor at UBC and is now the Dean of Pharmacy in Qatar, which is part of the United Arab Emirates. And he's gone over there and really souped them up. We're very happy with them. Interestingly, in Qatar, the Emir has decided that pharmacy is a female profession. No males are allowed. And so that's interesting for Jewison because when he lectures, he has to have 2 female bodyguards or deflectors, and he's had to clean his mouth up a whole lot in order to function over there. Mark Levine, I've already mentioned, is a full professor. And we have Gary Lopez-Chuck, who's here tonight. Gary's a full professor of pediatrics and pharmacology at the University of Alberta, and he was recently named the scientific director of the Mazikowski Alberta Heart and Stroke Foundation. So that's really a big deal. This is a state-of-the-art institution. And he was also made a member last year of the Royal Society of Canada, which is another academic accolade that doesn't go to too many people. Gary's heart is still on the West Coast. In fact, he and Kath have property out here, and he just bought a boat, which he doesn't know how to drive yet, but he's working on it. And he tells me the propeller's bent and something else is wrong because they keep running over things. I don't know if you've been following the news about Somalia. You have all these pirates coming out from ports in Somalia that attack ships and kidnap the people they get and hold them for ransom for $1 million. I think the Canadian Navy should be informed about Gary's possession of this boat because I expect that similar things may happen here. In addition to these 3 folks, many of you in this room have been involved with the faculty as clinical instructors, and it's greatly appreciated. Some folks I just mentioned by name, some of whom are here tonight. Janet Webb in drug information, Don Hamilton, hospital pharmacy, Alan Glasser in community pharmacy, and Alex Tam is not only a tremendous community pharmacist, but also a guy with a whole lot of heart. I don't know if you've read the recent reports on all the good things he's doing on the downtown east side, where he's affectionately known as Buddha.